Excellencies, partners, ladies and gentlemen, I would like to thank PMNCH for organizing this important summit. I regret that I cannot be with you in real time and am coming in by video. My contribution will focus on increasing COVID-19 vaccination coverage with a focus on high priority groups, health and other frontline workers, the elderly, and people living with comorbidities, to protect lives while strengthening healthcare systems, especially in humanitarian and fragile environments. We realize today that the biggest inequities in COVID-19 vaccination are not just between high-income and low-income countries, but also between the general population and those who live in fragile and vulnerable settings, many of whom are women and children. With 11.7 billion doses administered globally, 74% of people in high-income countries have completed their primary vaccination, vis-à-vis 13% in low-income countries and only 8% in fragile and conflict settings. The COVID-19 Vaccine Delivery Partnership was launched in January by UNICEF, the WHO, and Gavi to support in-country vaccination delivery in the 92 advanced market commitment countries with a focus on providing urgent operational support to 34 countries that were at or below 10% full vaccination coverage in January 2022, representing half of all the unvaccinated population in AMC participants. These include some of the world's most fragile settings. Among the countries with the lowest vaccination rates, we are starting to see diverging trends. Since January, the number of countries with vaccination rates at or below 10% has dropped from 34 to 18. Of the 18, 14 countries are facing humanitarian emergencies. This means that the world's most vulnerable people, including refugees and internally displaced, are likely to be vaccinated last, if at all. However, this should not be a reason to slow down. Some countries in fragile settings have managed to accelerate vaccine uptake despite the emergencies they face. In the Central African Republic, the vaccination rate has doubled since January to reach 20% due to strong community engagement, proactive collection of behavioral data, and the debunking of myth using community radios. Strong leadership in Chad and Ethiopia has allowed for similar progress. What we need to focus on in these settings is to pursue COVID-19 vaccination in a manner that recognizes other health and humanitarian priorities and uses COVID-19 vaccination as a way to strengthen health systems. Vaccinating healthcare and other frontline workers and the elderly against COVID-19 protects them from serious disease and death and from loss of income due to loss of working days. Countries that have been able to increase COVID-19 vaccine coverage have done so through campaigns, and we need to make sure that these are quick, targeted, and take into account other health and humanitarian priorities in terms of sequencing and opportunities for bundling and funding. In humanitarian and fragile settings, successful vaccination can take place by integrating COVID-19 vaccination into the package of humanitarian services provided to the population. We need in particular to focus on IDPs and refugees and support those that are accessible in camp and other settings. COVID-19 vaccination is an opportunity to strengthen the health system, not only the cold chain, but the strengthening of health management information systems and the onboarding, training, and remuneration of healthcare workers. In Ethiopia, 5,000 surge workers bought in to address the pandemic will now stay on in the system to support with other primary healthcare activities and strengthen capacities to be prepared for future pandemics. As we prepare for the next pandemic and the integration of the COVID-19 response into primary healthcare where it belongs, it is important to continue to address the current pandemic and use the assets and resources associated with the response to address inequities and protect the most vulnerable. Thank you.